Hello and welcome. I'm Greg Lake, co founder and CEO of Fourth Power Labs. Today, we're excited to present guidelines for recommending Cannabidiol CBD. This webinar will be the first of many as Fourth Power Labs looks to help medical professionals serve their patients better. Today's format will not only include today's content, but Dr. Patel and I will also be answering your questions at the end. If you have questions, I encourage you to enter those into chat throughout the call. Today, I have the pleasure of introducing our speaker, world recognized cannabis medicine expert, Dr. Rachna Patel. Dr. Patel is the Chief Medical Advisor for Fourth Power Labs. She completed her undergraduate studies at Northwestern University in Illinois and earned her medical degree from Touro University in California. And she is also licensed in the state of California. After spending time training as an emergency medicine doctor and working with patients to help alleviate pain, Dr. Patel ventured into the field of cannabinoid medicine in 2012. In 2014, she started her own practice so that she could offer people care they otherwise didn't have access to. Her consultations have helped thousands of patients relieve their symptoms, transform their health, and live a better quality of life with cannabinoid products. Now on a mission to impact lives beyond her lifetime, she's published a book in partnership with Penguin Random House and has grown a YouTube channel to over 1 million views. She's been interviewed on over 300 podcasts, serves as a go-to media correspondent, and has taken the stage internationally, educating both medical and non-medical audiences. And most importantly, she dedicates her time educating other medical professionals about cannabinoids. Please join me in welcoming Dr. Rachna Patel.
Thank you so much, Greg, for that very generous introduction. So for those of you who are on this call, I want to point out that of late, I have made it my mission to educate other medical professionals, because there's a lot of medical professionals out there who are getting questions from patients about cannabinoids, specifically CBD, and they don't necessarily have the knowledge and or experience to answer these questions. And that's what I want to do for you today, is give you a basic foundation when it comes to cannabinoids so that you're well informed in answering patients' questions. So let's go ahead and get started. What I'm going to go over is, first and foremost, the biochemistry of the endocannabinoid system. That will then give you a good foundation upon which to build the pharmacology of cannabinoids, including CBD. Then I'm going to delve deeper into the research and clinical outcomes for the most common indications for CBD. And this includes anxiety, chronic pain, as well as insomnia. And then I'm going to end the webinar with a review of the Fourth Power Labs products line. And specifically, we'll go over product selection, product quality, etc. All right, so what is the endocannabinoid system? Now, in order to fully appreciate the rationale behind the medical use of cannabinoids, it's essential to know about the endocannabinoid system. So that's where we're going to start. Now, the endocannabinoid system is essentially a homeostatic regulatory system that influences multiple physiological processes, including modulation of pain, appetite, mood, seizure threshold, digestion, coordination, etc. It also has an influence on a number of systems in the body as well. And this includes immunomodulation, cardiovascular function, sensory integration, tumor surveillance, and a slew of other systems in the body that you can see in front of you on the slide. Now, if I had to sum up the core functions of the endocannabinoid system, they would be to relax, to eat, to sleep, to forget, and to protect. All right, so just like any other regulatory system in the body, the key components of the endocannabinoid system are its ligands, its receptors, and its regulatory enzymes. So let's get well versed with each of these components. Starting with the ligands, specifically, let's dive into the agonists. And there's three types. There are endocannabinoids, there are phytocannabinoids, and there are pharmaceutical cannabinoids, which can further be broken down into synthetic pharmaceutical cannabinoids and cannabis-derived pharmaceutical cannabinoids. So with the endocannabinoids, two of the most well-studied endocannabinoids are derivatives of arachidonic acid, which is a polysaturated omega-6 fatty acid. Anandamide was discovered back in 1992, and 2-HG was isolated back in 1995. So in the grand scheme of things, relatively recently discovered molecules. Now, both of these endocannabinoids are synthesized on demand, meaning that there is no evidence of their storage inside vesicles. Next, we have phytocannabinoids. Now, these are cannabinoids derived from the Cannabis sativa plant species, which includes both marijuana and hemp. And they either interact with the endocannabinoid receptors directly or otherwise affect the endocannabinoid system indirectly. So for example, the anti-inflammatory effects of phytocannabinoids may be non-receptor mediated. Now, more than 100 of these chemicals produced by the Cannabis sativa species are categorized as cannabinoids, of which THC and CBD are the most commonly occurring cannabinoids. So THC was isolated in 1964 and CBD was identified in 1940, but its chemical structure wasn't determined until 1963. Now, the primary psychoactive cannabinoid is delta-9 tetrahydrocannabinol, which is otherwise known as delta-9 THC, or more commonly known as just THC. Other cannabinoids, including delta-8 THC, cannabinol, cannabigerol, cannabidiol, which is CBD, etc., have no significant psychotropic effects compared to THC. So I do want to point out the difference between hemp and marijuana. Both are of the Cannabis sativa species. So they're within the same family, and you can think of them essentially as siblings, with the difference boiling down to the amount of THC. So by law, hemp-derived products have to have less than 0.3% THC. And by default then, marijuana-derived products have more than 0.3% THC. Now, most products known as CBD oil or derivatives thereof are derived from hemp. Now, in most states, hemp-derived products are available without a prescription, whereas in a lot of states, marijuana-derived products, you have to have a prescription in order to utilize marijuana-derived products. Several pharmaceutical drugs have been developed which either contain cannabinoids or are similar to cannabinoids in Cannabis sativa. So as previously mentioned, there are two types of pharmaceutical cannabinoids, cannabis-derived and synthetic. The cannabis-derived pharmaceutical cannabinoids really are no different than the cannabis-derived products currently available on the market, other than the fact that they're, supposedly created under more standardized conditions. All right, so I'm going to start by talking about the cannabis-derived pharmaceutical cannabinoids, starting with nabiximols, which goes by the trade name Sativex. So it's a cannabis-derived extract with a 1-to-1 ratio of CBD to THC. It was approved in the UK in 2010, making it the first cannabis-based prescription medication in the world. In addition, it's also approved to treat spasticity caused by multiple sclerosis in numerous different countries throughout the world. In 2015, in the first of 3 phase 3 trials in the United States for the treatment of pain in patients with advanced cancer, Sativex did not meet the primary endpoint of demonstrating a statistically significant difference from placebo. Currently, it's undergoing phase 3 trials in the United States for the treatment of spasticity in patients with multiple sclerosis. Cannabidiol CBD was given the trade name Epidiolex in 2018 when the FDA approved it for the treatment of seizures associated with Lennox-Gastaut syndrome and Dravet syndrome in patients 2 years of age or older, and it's essentially a cannabis-derived extract of CBD. All right, moving on to the synthetic pharmaceutical cannabinoids. So I'm going to start with dronabinol, which goes by the trade name Marinol. And you may be familiar with this one. It's an isomer of delta-9 THC. And in the United States, it was approved in 1985 for the treatment of chemo-induced nausea and vomiting. Then, in 1992, it was approved for appetite stimulation in AIDS patients. And what started off as a Schedule I drug made its way to Schedule III drug as of 1999. Now, this drug is also approved in several other countries. For instance, in Denmark, it's approved for treating multiple sclerosis. And in Canada, much like in the United States, it's approved for AIDS-related anorexia and for nausea and vomiting associated with chemo. All right. Then we have nabilone, which goes by the trade name Sesamet. Now, nabilone is an analog of delta-9 THC. In the United States, it was approved in 1985 for the treatment of nausea and vomiting in patients undergoing chemo. And it's also been approved in, again, numerous different countries for the treatment of also chemo-induced nausea. Now, in Belgium, interestingly enough, it's approved for the treatment of glaucoma, amongst also the conditions that I just mentioned. All right, so I know that it may feel like I shared a ton of information about cannabinoids with you, but take a look at this table. It does a relatively comprehensive job of listing out the various cannabinoids by class. And you'll see that really I just gave you a sneak peek into the world of cannabinoids, and there's still really a great deal to learn. All right, moving on. I want to talk about antagonists, and one in particular, rimonabant, and it has a really interesting story behind it. So it's the most well-studied endocannabinoid antagonist. Now, rimonabant was marketed in Europe for the treatment of obesity. And the logic behind this was that, well, THC consumption oftentimes causes the munchies. So if we antagonize the endocannabinoid system, it's going to reduce appetite and therefore reduce weight in obese individuals. But here's what happened. It had to be withdrawn from the market because it produced adverse effects in some patients, which included depression and suicidal ideation. Now, these side effects speak to the significance of the endocannabinoid system in emotional processing. All right, so next let's move on to receptors. Okay, so there's two well-known cannabinoid receptors, cannabinoid receptor 1, otherwise known as CB1, and cannabinoid receptor 2, otherwise known as CB2. The TRPV1 and GPR55 receptors are also often characterized as cannabinoid receptors. So CB1 receptors are highly expressed in the brain. In fact, here's the interesting thing. In humans, the CB1 receptor is 10 times more prevalent in the central nervous system than the mu-opioid receptor. CB1 receptors are also found in non-neural tissue, including adipose, liver, pancreas, skeletal muscle, and immune cells. CB2 receptors are primarily immunomodulatory and anti-inflammatory. They're expressed on the cell membranes of B cells, T cells, and macrophages. Now, here's the interesting thing about CB2. Its expression is inducible by inflammation. So research conducted in mice demonstrated that reduced CB2 receptor signaling results in increased severity of inflammation in multiple organs, including the brain and the liver. Now, both of these receptors are G-coupled protein receptors. And what I want to do next is walk you through how the ligands that I taught you about interact with each of these cannabinoid receptors. So let's start with the endocannabinoids, anandamide. Anandamide is a partial agonist at CB1. Its affinity and efficacy at CB2 are low. It's also a partial agonist at TRPV1. 2-AG is fully efficacious at CB1 and CB2. Now, the phytocannabinoids. So interestingly enough, CBD's mechanism of action does not involve a direct binding to either CB1 or CB2. What it does is that it produces an effect by inhibiting FAAH. And I'm going to talk about FAAH further in a little bit, but it's the enzyme that breaks down anandamide and therefore makes more anandamide available for binding to receptors. CBD also produces an effect by binding to TRPV1 and to serotonin receptor 5-HT1A. And then finally, CBD also acts as a negative allosteric inhibitor, changing the shape of CB1 and preventing THC from binding CB1. All right, so the next phytocannabinoid I want to talk about is THC. THC is a partial agonist at CB1 and CB2. And next I want to talk about the regulatory enzymes. Okay, so overall, the pathways controlling the production of anandamide are not well understood, but it's believed that anandamide is formed from membrane phospholipid precursors through the activation of phospholipase C, followed by the activation of diacylglycerol lipase. Anandamide is hydrolyzed by fatty acid aminohydrolase, otherwise known as FAAH, into two breakdown products, arachidonic acid and ethanolamine. And in preclinical studies, it's been found that inhibition of FAAH raises anandamide concentrations and reduces anxiety-like behaviors. 2-AG is synthesized from diacylglycerol through the actions of diacylglycerol lipase and is hydrolyzed by monoacylglycerol lipase into the breakdown products arachidonic acid and glycerol. All right, so now let's take a deep dive into the pharmacological profile of phytocannabinoids. And really, when it comes to clinical outcomes, the pharmacology is the most practically useful information you'll have on hand. So I want to start with the most common routes of administration of phytocannabinoids. So there's inhalation, there's oral, there's sublingual/oral mucosal, there's rectal, there's topical, and there's vaginal. Now, I'm going to skip over the details about inhalation because it's not relevant when it comes to hemp-derived CBD products. So let's start by talking about the oral formulations. So the oral route of administration, the most common oral phytocannabinoid products on the market include gummies and chocolates, as well as soft gels. Then there's the oral mucosal or sublingual route of administration. Products utilized for oral mucosal or sublingual administration are known as tinctures on the market. Then with rectal administration, it dates back to the 19th century, and I have in fact utilized it in my clinical practice. With topical formulations, here's what's important to know. So CB1 is expressed in keratinocytes within the more differentiated epidermal layers, hair follicle cells, sebaceous glands, and sensory neurons. CB2 is also expressed in keratinocytes, sebaceous glands, and sensory neurons, and therefore facilitates efficacy of phytocannabinoids as topicals. When it comes to vaginal formulations on the market, you'll typically come across it in the form of lubricants. Okay, so when it comes to absorption of phytocannabinoids, the rate of absorption is determined by the route of administration and drug formulation. So having said that, when it comes to topicals, for example, the permeability of CBD was found to be 10 times greater than the permeability of THC. In terms of onset of action, the minimum you'll see is seconds to minutes with inhalation, and the maximum you'll see is up to 2 hours with ingestion. There's a common misconception here amongst users that it only takes ingestion of about 20 minutes to take effect, but really it takes up to 2 hours to take effect. And then with the other routes of administration, the onset of action falls between this minimum and maximum range. Duration of action. The minimum you'll see is about 2 hours with inhalation, and the maximum you'll see is up to 12 hours with ingestion. And again, the duration of action of the other routes of administration falls between this minimum and maximum range. Now, I want to talk about peak effects here as well. So with inhalation, the peak effects occur approximately 30 to 60 minutes post-inhalation. And with the oral route of administration, the peak effect occurs approximately 6 hours post-ingestion. And then the peak effects of the other routes of administration fall within this minimum and maximum range. All right, so next we have distribution. So the distribution of cannabinoids is time dependent, and it begins immediately after absorption. Cannabinoids are taken up by fatty tissue and by highly perfused organs such as the brain, the heart, the lungs, and the liver. Because both CBD and THC are highly lipophilic, they readily pass the blood-brain barrier. Okay, so when it comes to metabolism, cannabinoids are mainly metabolized in the liver, where they produce more than 20 different metabolites. When it comes to the elimination half-life of cannabinoids, here's what's really, really important to know. It has 2 elimination half-lives. It has a plasma elimination half-life, and it has a tissue elimination half-life, okay? The plasma elimination half-life of cannabinoids in occasional users is approximately 56 hours. In chronic users, it's shortened to 28 hours. Now, due to the sequestration in fatty tissue, due to the sequestration of cannabinoids in fatty tissue, the tissue half-life of cannabinoids is 7 days. And the complete elimination of just 1 dose may take as long as 30 days. When it comes to elimination in general, roughly 20 to 35% is eliminated in urine, and 65 to 80% is eliminated in feces. All right, so as you may have seen, in the environment around you, cannabinoids are being marketed for an array of medical conditions. Now, suffice to say, they're not a cure-all, but having said that, according to the findings in the National Academy's literature review, there's strong evidence from randomized controlled trials to support that cannabinoids are an efficacious treatment for chronic pain, specifically neuropathic and palliative and end-of-life pain, chemotherapy-induced nausea and vomiting, spasticity due to multiple sclerosis, or spinal cord injury. Now, specifically when it comes to CBD, I want to walk you through outcomes in both clinical studies as well as in my clinical practice for the most common indications, namely chronic pain, anxiety, and insomnia. So the first study that I want to walk you through was published in 2003, and it looked at the effects of whole plant extracts of delta-9 THC, CBD, and 1-to-1 CBD to THC, specifically on neurogenic symptoms due to multiple sclerosis, spinal cord injury, brachial plexus injury, and limb amputation. These patients were unresponsive to standard treatment, and ultimately, in comparison to placebo, CBD significantly improved pain. CBD also appeared to have an antispasmodic effect. Another study, published in 2020, audited a patient population referred to a primary care clinic in New Zealand specifically for CBD oil. Results showed that patients experiencing non-cancer pain symptoms had a significant improvement of self-reported mobility, ability to complete their usual activities, pain and anxiety, and/or depression. Patients with mental health-related symptoms experienced improvement also in their ability to carry out their usual activities, pain and anxiety and/or depression. And then finally, patients with cancer symptoms experienced improvements in pain. And overall, of those prescribed CBD, 44% reported good to excellent benefits for relatively intractable conditions. All right, so what sort of results have my chronic pain patients experienced? Results play out in a couple of different ways. So one, patients with chronic pain experience greater pain relief with the addition of cannabinoids to their opioid regimen. Second, combining cannabinoids with opioids allows for opioid treatment at lower dosages with fewer side effects, or combining cannabinoids with opioids results in discontinuation of opioid use altogether. Okay, moving on to anxiety. Specifically, I'm going to be talking about anxiety in the context of social anxiety disorder, but this can, the results can essentially be extended to a wide variety of conditions of anxiety. So this particular study was published in 2011, and it compared the effects of a stimulated public speaking test on healthy control patients and treatment-naive social anxiety disorder patients who received a single dose of CBD or placebo. Participants received CBD or placebo an hour and a half before the test, and the healthy control performed the test without receiving any medication. Pre-treatment with CBD significantly reduced anxiety, cognitive impairment, and discomfort in speech performance, and significantly reduced alert in their anticipatory speech. The placebo group, on the other hand, presented higher anxiety, higher cognitive impairment, higher discomfort, and higher alert levels when compared to the control group. So the preliminary results indicate that a single dose of CBD can reduce the anxiety-enhancing effect provoked by public speaking, specifically in this case, social anxiety disorder patients. All right, now let's talk about results that my anxiety patients have experienced. So I'm going to walk you through results in their own words. So patients have overall reported back that the CBD works, and it works quite well. They report feeling more calm and more relaxed. They've said that CBD eases their anxiety in a way that allows them to function. They no longer feel paralyzed by the anxiety. The racing thoughts they have while lying in bed trying to fall asleep tend to disappear. And it allows them to fall asleep, stay asleep for a good 7 to 8 hours, and wake up feeling more rested. Now, being more calm and relaxed as well as better rested, patients report that they're able to take on the challenges of the day with greater focus and concentration. They're also able to experience anxiety relief in a way that improves their current relationships. So they find that they're no longer chronically tired, obsessively worried, or snappy, and it makes for a better quality of life and time spent with family and friends. Now, as for the patients who experience panic attacks, they report results from having total and complete elimination of their panic attacks to a reduction in the number of panic attacks that they experience, as well as a reduction in the severity of the panic attacks, wherein they're able to ride them out instead of being completely debilitated by them. Patients also report a range of effects on the use of their prescription medications, including SSRIs and benzos, amongst other anxiolytics. So some are able to completely eliminate the use of prescription medications. Others are able to significantly reduce the dose and/or the number of prescription medications they take. And then there are select few who do have to continue to take their prescription medications for the anxiety, but they experience greater relief of their anxiety by combining the use of their prescription medications along with CBD. At the same time, patients find that, unlike with SSRIs, CBD doesn't take as long to take effect. Now, oftentimes, as you may know, it takes up to 8 weeks to see any changes from SSRIs. Whereas with CBD, patients can feel an effect within the first couple hours, given that they're taking an appropriate dose. And unlike with benzos, patients do not experience withdrawal symptoms upon abrupt cessation of CBD. Next, I want to talk about difficulties sleeping, starting with some research. So This particular study was published in 2019, and they did a retrospective study on the clinical application of CBD specifically for anxiety and sleep complaints as an adjunct to usual treatment. Now, overall, sleep scores improved by 66.7% in the first month, and 2 months after the start of treatment, 56.1% of patients reported an improvement in sleep. So, what sort of results have my patients with sleep disorders, specifically anxiety, experienced? So, to start off with, patients with mild to moderate insomnia need different treatment than patients with severe insomnia. So, those with mild to moderate insomnia fare better with CBD. There's two different options here. There's the option of recommending marijuana-based CBD products or hemp-derived CBD products. Between these two options, I'd say the hemp-derived high CBD products is preferred, and it's because it has more of what they need, CBD, and less of what they don't need, THC. And again, remember, CBD products made with hemp, by law, have less than 0.3% THC, which mitigates the likelihood of getting high off of the THC. All right, so overall, patients who use CBD products for insomnia report back, number one, they fall asleep easily. Number two, they stay asleep through the night. And number three, should they wake up in the middle of the night, they fall back asleep easily. And this is of great utility to patients, for instance, who wake up due to frequent urination. Okay, so the next thing that I want to go over are the line of the Fourth Power Labs products. Okay, so there are a variety of products available that can be administered in numerous different ways. Overall, there are orals that come in the form of soft gels, there are sublinguals, and there's a topical, which is a roll-on, okay? So here's what I want to tell you. Let's talk about internal use of CBD products and external use of CBD products first. So when it comes to internal use of CBD products, in general, those are best utilized for mental health conditions, for instance, anxiety, for pain, specifically pain that's systemic, as well as for insomnia, okay? Now, external use products, so for, in this case, the roll-on, it's best utilized for pain that's localized, so for instance, muscular pain or bone pain. So for example, if someone has an arthritic joint, just a single arthritic joint on the thumb, that would be a good instance to recommend the roll-on product. And then in addition, topicals are of great benefit for inflammatory skin conditions such as psoriasis and eczema, for instance, being that they don't have any sort of allergies to any of the other ingredients in the topical formulation. All right, so next we have, I want to dive into sublinguals. So specifically with the Fourth Power Labs products, what I want you to hone in on is the third chart down. See where it says CBD? So in these products, there is 17.6 milligrams of CBD per serving. Now, per serving, if you look at the dropper all the way to the right, is 1 milliliter, okay? So you know exactly how much CBD the patient is getting, okay? And what's great about having this dropper is that you can be exact and precise in titrating dose. Now, the other thing that I want you to notice is that there's other cannabinoids present as well, right? So for instance, CBDV, CBG. When you have other cannabinoids present, there's potential for what's known as an entourage effect or synergistic effect, right? So it's a situation in which the other cannabinoids enhance the effect of CBD, for instance. So that, and then the other thing that I want to talk about is delta-9 THC. If you look next to it, it says ND, which means non-detectable, okay? So I'm going to go over to the next slide here. Where I want you to follow along is where it says delta-9 THC. If you look across, it has less than 0.005% THC. So essentially, this is what's known as a broad spectrum product on the market. Broad spectrum CBD products have, by definition, less than 0.00% THC, which is why on the lab test results, it shows as non-detectable. Okay. And the other thing that I want to point out is that the other types of CBD products on the market are full spectrum CBD products. So that THC range falls between 0.3% THC and greater than the 0.00% THC. And then there are isolate CBD products as well, whereby they use chromatography and solvents to just isolate the CBD. With full spectrum CBD products, there's still potential for a psychoactive effect because, when it comes to the absolute value of THC, the patient, depending on how much they consume, they may be consuming an amount that has potential to cause a psychoactive effect. With broad spectrum products, the amount of THC is essentially negligible. So there is very low likelihood of getting any sort of psychoactive effects from these products. With isolate CBD products, the worry there is that there's an extensive use of solvents, and it's essential to ensure that the product has been well tested for residual solvents to ensure that there's no toxic levels left behind. All right, now, when would you use sublinguals? So sublinguals are a good option for patients who are naive to CBD products in general. And they're unfamiliar with what dose is appropriate for them. So this is a good product to start with because it's so convenient in adjusting dose and in figuring out dose. When it comes to using sublinguals, essentially, I tell patients to leave the drops there under their tongue for up to 30 seconds. Now, the misconception is that you spit out whatever's remaining in your mouth. You don't, just swallow the rest. And that's essentially, those are the main points that I wanted to make about sublinguals. Okay, then there's also oral soft gels. Okay, so with soft gels, again, what I want to point out to you here is that per soft gel, again, look at the third chart down next to CBD, it says 22.53 milligrams of CBD. So you know exactly the amount of milligrams you're administering to the patient. In addition, you'll notice that there's other cannabinoids present, whereby there's potential for that entourage effect. Again, the delta-9 THC is non-detectable. So if you look at this lab test result, again, the delta-9 THC is less than 0.005% THC, making it a broad spectrum CBD product. Okay, so orals, when to use orals. Orals are great once a patient has figured out their exact dose and they want to just have a more convenient way of administering CBD. And that's a question that I've gotten a lot from my patients. Once they've figured out their dose, they'll tell me, hey doc, isn't there just a pill that I can pop? Because that's what they're so accustomed to. And so this is a great option for them. Now, here's the important thing about soft gels. They should always be taken on a full stomach, and specifically with something heavy in fat. So like, for instance, a spoonful of avocado, a little piece of toast with butter. The reason is because remember, cannabinoids are lipophilic. And so by consuming the soft gels with something heavy in fats, you give it a glue, you give the cannabinoids a glue to bind to, and it makes for better absorption. All right, next we have the roll-on. Okay, so with the roll-on, again, look at the third chart down. Here we have the total amount of CBD, which is 711 milligrams. And then again, you have the other cannabinoids, which creates a potential for an entourage effect, and the delta-9 THC is non-detectable, although you don't have to be worried as much with topicals when it comes to any sort of psychoactive effect, because the absorption is very local. There is no systemic absorption with topicals unless you're like bathing in the topical. And then again, look at the laboratory test results. If you look at the delta-9 THC, it is less than 0.005%, making it a broad spectrum CBD product. Okay, so when it comes to utilizing topicals, like I mentioned, it's great for muscular and bone pain. For patients who, for instance, have rheumatoid arthritis and they wake up with stiff joints, oftentimes what I recommend to them is to utilize it overnight and to wrap the joint in saran wrap, because the moisture and the heat will help it to absorb better. And then the next thing I want to talk about is combination of CBD products. So when it comes to combination of CBD products, you don't want to combine products that are made for internal use. Like, for instance, combining with a sublingual with an oral. And that's because the CBD in the body accumulates, okay? And so you're giving the patient way too high of a dose. But it's totally fine to combine an internal use product with an external use product. So for instance, if a patient has extensive arthritis on their back, as well as a single joint on their thumb with arthritis, that's a good instance in which to utilize both an external use product and an internal use product. The internal use product they can use for essentially the extensive pain that they have on their back, on their spine. And then the external use product, the roll-on, can be utilized for that single joint that they're having pain on. The other thing that I want to mention when it comes to application of topicals, typically I tell patients to reapply every 2 to 4 hours. And again, like I mentioned, there is no systemic absorption, it's only local. Okay, and now we're ready for questions and answers.
I believe Dr. Patel and Greg, we've been receiving that some are having a challenge with the chat function. If you are, please feel free to email marketing@fourthpowerlabs.com, and we will be accepting the questions through that conduit as well.
While we wait for questions, I believe one of the questions that appeared in the chat box is, will these slides be available following presentation? The answer is yes. We have recorded this presentation, and we will make it available to you via email that you used when registering for this webinar.
A question just came through around the certificate of analysis that was presented on the screen around best used by date. And the question is, how was that date derived? I believe, Greg, this is a question for you.
Yeah, that best use date is based on active ingredients and inactive ingredients that are used based on our knowledge for that in the longest available use date available.
A question came through email that asks about the spacing dose of drugs that metabolize in the P450 pathway, and are there any major categories of concern?
So like Greg mentioned, we're having a series of webinars. In the next webinar, I'm going to go over contraindications, and I will cover that in that. But typically, when it comes to frequency of use of cannabinoids, including CBD, based on the elimination half-life, right? So based on both the plasma elimination half-life as well as the tissue elimination half-life, I found clinically that patients at most utilize cannabinoids typically every other day, given the half-life. So hopefully that helps to answer that question. But if you have follow-up questions, just go ahead and email them.
Another question came through regarding the adjustment of dose based on the first pass effect. The understanding is that 30% is lost on oral administration, and is that your understanding as well?
Okay, so at this point in time, there's not sufficient data to come up with an exact number in terms of what's lost by method of administration. We do have data on inhalation, but not as much when it comes to sublinguals and when it comes to orals. And so dosing, I found, is a very individual process. But here's the thing: once a patient is able to titrate the right dose, they're able to stick to that right dose or stick to that dose and to their frequency, their appropriate frequency for an extended period of time without necessarily any changes to that dose or that frequency of administration. I say this because I've seen patients year over year over year, and once they figured out the right dose and the right frequency, there aren't many changes that have to be made. Including when they're changing prescription medications, because this is another system altogether whereby the cannabinoids are interacting. They're interacting in the cannabinoid system. And as far as we know, the other prescription medications aren't necessarily impacting the effect of cannabinoids on the endocannabinoid system. And like I said, we're going to be going over this more in the next webinar when I talk about contraindications, side effects, and drug interactions. Let's see here. So I see another question. Should patients take SSRIs with CBD? In the patients that I've treated, I have found no adverse drug-to-drug interactions with patients taking SSRIs and CBD. They haven't reported any adverse drug interactions. And in fact, in most case scenarios, what I find is that patients are able to eventually wean themselves off of the SSRIs and just utilize the CBD on a PRN basis to help with their anxiety.
All right, Dr. Patel, I see a question. What is different with Fourth Power Lab CBD products versus other competing products? That's a great question, and I could literally spend a half an hour describing the differences. First, I think it's important to note that this is a product that was developed specifically for medical professionals, and I'll talk a little bit at the end about why that is and why that's important. But it's only available through medical professionals, and we also like to consider this to be a pharmaceutical grade product. It starts with quality, right? Especially it's important to folks like you compared to patients that are buying it at 7-Eleven or the local grocer. Having a quality product that you can put your reputation and name behind is very important. And it starts again with the quality and the testing. So our testing, I believe, is second to none. We use Eurofins, and many of you recognize that name and understand that they're the group that is recognized by the FDA. The FDA works with them on methods as it relates to treating or testing cannabis type of material. Also, with that testing, we test well over 500 plus pesticides, 13 mycotoxins, multiple solvents. So our C of A's, when you take a look at them, and we invite you to do so, are well over 22 pages long, which shows again the breadth and depth. As it relates to potency, which is another piece that we heard over time and time again when we developed the product, many of the CBD products that you'll find out there, especially even in the medical channel, have a potency range anywhere from 10 to 15%, meaning what's on the label could be 10 to 15% different once it's in the bottle. If you notice the sublingual oil C of A that Dr. Patel flashed earlier for you, our sublingual oil is within a 2.5% band. So again, the quality, the rigor, the inputs to the product make it different. Also, I tell folks that are carrying CBD products, this is a great alternative brand to carry to capture folks that are looking for CBG. So our product, again, is very rich in CBG. It's 8-to-1 CBD to CBG, which is unlike any other medical professional grade product that is dedicated to you, which is getting traction, and folks appreciate, again, the CBG. The other piece is it's a broad spectrum. So So many of the lines out there today are full spectrum, or if they offer broad spectrum, it's very narrow in the dosage type and strengths. We have a very broad portfolio, and we are adding to it. So we're currently working on a chewable tablet that we think is going to be very attractive to your patients as well. And there's other things. We support you. We have a customer success specialist dedicated to your success, as well as we have talented folks like Dr. Patel on our team to help continue the education. Those are just a few. I encourage you to visit our website, fourthpowerlabs.com, where we get a little bit more in depth, and or feel free to call me direct, or we also have a lot of representatives on our team that would be happy to work with you.
And just to add to what Greg said, potency, accuracy with potency, when it comes to what's on the label versus what's on the lab test results, is very important, because you'll find products on the market that have a difference of greater than 20% based on what's on the label versus what's actually on the lab test results. And where that makes a difference is the results that patients experience, right? If the potency is within a specific target range, right? Less than, and you know this based on generics versus trade drugs, that having that small difference between what's on the label versus what's actually in the product makes a huge difference when it comes to results, right? Well, as pharmacists, you all know that when it comes to using levothyroxine generic versus Synthroid, the actual trade name drug. More often than not, you'll find physicians prescribe Synthroid as opposed to levothyroxine generic because of that, because we know that, you know, the smallest amount will make a difference in terms of getting patients consistent results. So that's where that is important.
One question I think I also want to ask before our time runs is, the question is the CBD and CBG grown in the U.S.? If not, where is it imported from? I will tell you emphatically, our commitment to you is to only deliver hemp that is grown in the United States. We also take it a step higher. We only work with a network of experienced and USDA accredited farms, again, located in key regions. And the reason why we diversify in the different regions is to delever the risk of drought, potentially insects that damage crops. So again, we have a network of accredited farms, and we do a lot of testing even at the biomass level to ensure the safety and efficacy of the product that you're getting. But that's a very, very good question, and one I wanted to highlight.
I think we have time for one last question before we start to go into the final piece of this. So, Dr. Patel, I think you're good. You're going to read it, but you know, is there a relative analgesic efficacy number of CBD versus THC?
Yeah, so here's what I'm going to tell you when it comes to efficacy numbers. So first and foremost, here's what's important to know. Clinically, what I found in my practice is that about 80% of conditions benefit from high amounts of CBD. Having said that, those conditions include migraines and headaches, muscular pain, and we're talking about mild to moderate nerve pain, anxiety, and insomnia. Okay, so all of these conditions, for the most part, benefit from high amounts of CBD. When it comes to hemp-derived products, the amount of CBD is just so much higher than the THC that you're not even looking at a ratio. With marijuana-based products, yes, you are looking at a ratio, but with hemp-derived products, you're not, because the amount of CBD far exceeds the amount of THC in the product, especially when it's a broad-spectrum CBD product.
Well, thank you very much, Dr. Patel and Greg, for answering the questions that came through. You know, these are great questions, and we appreciate the participation. I'm sure as you all, again, the follow-up will be that you'll receive the deck and you'll be able to process and digest the information. There may be more questions, so please feel free to send an email to marketing@fourthpowerlabs.com and we will get you those answers. But now I'd like to hand it back over to Greg Lake, the co-founder and CEO of Fourth Power Labs.
Thank you, Dr. Patel, and thank you, audience, for the great questions. There's no doubt that hemp-derived CBD is the topic of discussion and that many of your patients are misinformed and uninformed about the potential benefits CBD products offer. At Fourth Power Labs, we believe in the transformative role hemp products can play in your patients' lives, and we also believe that these products do not belong on the shelf of your local convenience store and administered casually. For the most effective care, hemp products should be taken under the guidance of medical professionals like you with dosing recommendations informed by the patient's medical history and knowledge of interactions with other medications. Fourth Power Labs was created with you, the independent pharmacy, and your patients in mind. The founders of Fourth Power Labs' knowledge of independent pharmacies and understanding of FDA regulated environments come from past leadership roles, decades of experience with companies such as AmerisourceBergen, Harvard Drug, Major, Rugby, and Lecco Medical. Whether you're new to CBD or looking to revitalize your CBD sales, Fourth Power Labs is committed to providing a safe, reliable product bolstered by educational resources that empower you to speak to your patients with confidence and knowledge. On behalf of the entire team at Fourth Power Labs, I would like to thank Dr. Patel for her insight, and most importantly, thank you, our audience, for your curiosity, interest, and time. This is the first in a series of webinars hosted by Fourth Power Labs. Within the next couple of days, you will receive an email asking for your feedback. Additionally, we would appreciate your recommendations on topics you would like us to present. If you found value in today's information and want to register for future webinars, you will have a chance to do so in the email that I just mentioned, or you can subscribe to our newsletter at fourthpowerlabs.com. This concludes our presentation. Thank you again. We look forward to partnering with you on your journey to make better happen.